We're still in the middle of the pandemic, and the next speaker we have, Marlon Burgess, has really been engaging in the real challenge of sourcing the necessary medical devices and PPEs that are necessary to address the current pandemic. So I'm going to ask Marlon Burgess to tell us about what he has been doing in South Africa and how he's also been thinking about sourcing for the continent as a whole. And given his experience, what does he think we can do to build our productive capacity in Africa in the medical devices space? Marlon Burgess.
Thanks, Prof. And thanks for the invitation to present on this important topic. The PPE supply chain was dramatically impacted by COVID. I think the previous speakers have mentioned the nationalistic tendencies that we saw in terms of countries clamping down on their supply. But what we saw in South Africa was that the private sector and the government, the Department of Health, came together in a very mature way to ensure that these products were able to be accessed by the frontline health workers, which made a significant contribution to, I think, the COVID support structures and the way South Africa dealt with the pandemic and is dealing with the pandemic. So I think just to start out by saying that public-private partnership was critical in terms of how we've been dealing with supply chain issues of PPE in South Africa. So I think what that alludes to, and I'll touch on that a bit later, is that South Africa is in the process of embarking on its own universal health coverage mechanisms, of which our local version is called the NHI, the National Health Insurance. So what it has shown is that the public and private sector can come together in an emergency. So my challenge to everyone is universal health coverage, not in an emergency. And this pandemic has forced some entities together who typically are not able to collaborate in a meaningful way around something as critical as healthcare and the ecosystem that is healthcare and the complex ecosystem that is healthcare. So for me, it's been extremely encouraging to see that the public and private sector can work together in this way, because that points to the question you asked about what needs to be done in Africa. That to me is the most critical component about what needs to be done, is that the public and private sector has to come together, but not in the case of an emergency like we've seen now. We need to come together as a strategic initiative towards strengthening the health system. Because the argument is that it's a health problem that has caused this economic meltdown. Should we not be reverse engineering the entire process to strengthen the health system, to protect the economy? So that's the challenge I've been putting out to everybody. And that's something as local manufacturers in South Africa that we're actively working towards. Because in South Africa, we only manufacture 10% of, if that, 10% of the medical devices that are required in our hospitals and clinics is currently manufactured locally. So for me, that is a shocking statistic. And I imagine if you go through every country in Africa, you get similar type of statistics. So for me, that's a lack of leadership. It's a lack of effort. It's a lack of strategy. It's a lack of everything. Why is that happening? We have so much innovation coming out of Africa. If you look at what's happening in the mobile phone industry, for example, and technology industry, Africa is a leader in that space. From South Africa, we did the first heart transplant here. We were part of the team that made the first MRI scanner. There's been significant innovations out of Africa, but for some reason, we haven't developed the value chain to the point where we can start to export and value add to these products in a way that is a significant contributor to the economy of Africa. So I was extremely encouraged by what I heard earlier in terms of in Nigeria, for example, the government stepping in to support the pharmaceutical industry. But once again, that was a reactive initiative. Why aren't we doing this proactively? Why aren't we doing this strategically? And I'm hoping that with the Africa Free Trade Agreement, this becomes a strategic conversation, not a reactive one. So I think I've been encouraged by the previous speakers in terms of all of the collaboration that has started to happen in different areas like regulatory, etc. But I think we need to unpack this complex value chain that is the health sector. It's extremely complex. I think previous speakers like Kurtie and Dr. Skumbuza have alluded to that. But only in terms of outcomes, if we work together as a team and collaborate in these different areas, will we be able to achieve success. I want to just allude to 3 examples that I've been exposed to that we can take into the Africa Free Trade Agreement. The first is the example of Ireland. In terms of the medical devices sector, Ireland went from being like ranked number 20 odd in the world to be in Europe, I mean, to be ranked number 3 in terms of exports of health products. And this they did on the back of the previous economic meltdown, where they identified the health sector as a strategic economic driver. So they implemented all kinds of incentives to attract the multinationals into Ireland. If you think about all the companies who are currently have their head offices in Ireland, Johnson & Johnson, Medtronic, some of the other big ones are all located there because of the very attractive incentives that exist in Ireland. And further, they incorporated some of the savings, the tax savings that companies have in Ireland into the value chain, so that a component of the taxation is leveraged towards a fund, which is the basis of a mechanism to support the sustainability of SMMEs in the value chain. And it includes offtakes and training, etc., etc. It's a wonderful example. The second example is the example of Israel, who leverage their technology in the military into the health sector. And so basically they worked with what they had. So they had a strong presence in military technology, which was leveraged across into the health sector. And they used that as a basis on which to build all of their innovation for health. And that is why many companies, multinational companies, will look at Israel first for IP, for new product development. And that has created a value chain of significant economic value for that country. And then the last one I want to talk about is Malaysia, because they introduced this Pomando concept, where the government brought in this whole project management type of environment, which we struggle with in Africa. We struggle to implement projects in Africa. The example of Malaysia is that the president leads the project management team for the National Development Plan. So they put a Gantt chart together of all the projects that they want to roll out in a year, and they have monthly meetings in terms of where they are with the project, led by the president. That is why they're able to execute in a very holistic way. That's something we can learn from Malaysia in terms of how to properly execute projects. So if we're going to get it right, if we're going to make the Africa Free Trade Agreement work, I want to leave us with those thoughts in terms of how we take this forward and how we collaborate as a collective in terms of making it happen. I'm really looking forward to it. It's a very exciting development. And I'll leave it there for now. Thanks.
Thank you very much, Marlon. Your experience during the pandemic really, I think, is so instructive about what's possible. And your point that health is a systemic issue, this is a point that has been dawning on all of us, I hope, across the world, that if we don't address the health issue and build resilience, we are going to undermine our economic development. So Marlon Burgess, you have done so much of work during the COVID, during this period, sourcing, medical devices for Africa. Share with us how you think we can go forward, given the discussion we've just had on the opportunity in Africa for us to work together.
Thanks, Prof. I think what has come out quite strongly from the speakers is the the issue of policy coherence in the first instance, to get the strategy right. And then, as I've spoke about earlier, is the partnerships between the public and private sector. We weren't able to provide PPE to the health workers if we didn't have that partnership approach. So I think if we can sort out those differences between public and private sector and get the policy coherence right, and then look into the value chains for the opportunities, because what I didn't mention was that in South Africa we pivoted some of the companies that weren't doing medical devices into devices. Guys who are working in mining started manufacturing masks, for example. So I think we need to look at each, I think the previous speaker spoke about regional opportunities, look at the strength of each region and then pivot those into a broader Africa perspective in terms of the regional value chains. So I think for me, if we can get those elements right, but more importantly, I think is on the subject of implementation is to manage each of these initiatives as projects. So to do the proper business planning and then to appoint the project managers, maybe one from each region or in the region, to appoint the appropriately skilled project managers to execute the projects and get the public sector to understand that they are the facilitators and that the private sector has all of the resources and the skills to implement and get that partnership together. Because I think if we do that, we can get a sustainable manufacturing capability in Africa going through the Africa Free Trade Agreement. Thanks, Prof. Thanks for the invitation.